This is an in-service training program presented by Nutrition Care Systems. Today's topic, care planning made easy. Upon completing this in-service, you will be able to, number one, understand what a care plan is and what it's used for. Number two, understand how a care plan is developed. And number three, understand how to use the care plan for resident nutritional care. What are care plans? So care plans are the action plan created by the residents and staff on what will be done to get a resident from where they are to where they want to be. Care plans are to be an action plan that involves the resident, and it should be referred to frequently, not gathering dust somewhere, to check progress and make adjustments as needed in order to meet the goals. So we'll talk about problems and needs, goals, interventions, and monitoring. So first off, problems, needs, or strengths should come from the assessment, also from observations of the resident, any interviews that you might have had with the resident, record review, especially anything from the hospital that might include a care plan or plan of care that the resident had at the hospital, or any other facility that they may have come from, and also the MDS and the cause. So examples of problems would be energy intake less than estimated needs, protein intake less than estimated needs, any unplanned weight loss, behaviors at mealtime that interfere with food intake. Examples of needs would be assistance with eating related to arm and sling. Strengths, one would be a BMI in the normal status range, which would be a positive, or energy intake reflects estimated energy needs. Here's some examples of measurable goals. No significant weight change during this review period. Consistently consume 60 to 70% of meals, which would provide for 100% of estimated energy needs. As we know, some residents may eat 60 to 70%, and for them that is adequate, so it actually is meeting their needs. No signs or symptoms of tube feeding intolerance during this review period. Then you want to have a time frame to achieve that goal. So examples of time frame, typically it would be a quarterly review, but you can also change any part of the care plan as needed or when needed before the next review date. You may use less time than a quarterly. You may want to achieve a goal in a few weeks, then on to the next level of that goal. Examples would be maybe that resident would consistently be able to eat 76 to 100% of breakfast in the first 4 weeks. Then the next goal, 76 to 100% of breakfast and no less than 50% of lunch the next 4 weeks. By the end of the quarter, may be able to eat 76 to 100% of all meals. So care plan approaches, those are the interventions or the action needed to help achieve the goal. So list the approaches that will independently or collectively help the resident achieve each goal. So as far as examples of approaches, some would be diet as ordered, supplement as ordered, food preferences as reasonable, assistance with meals at level needed to achieve the goal. That may include special utensils, plates, cups, or plate guards, and then a dining room table or chair that resident prefers. Other care plan approaches would be dining in the room per resident preference or dining with friends per their preference. Dining in an atmosphere with reduced or limited distractions, for example, no loud music or disruptive talking or TV. Notify appropriate parties of unplanned weight loss or gain, or also notify appropriate parties of notable change in intake. So in summary, care plans are action plans based on a person's identified problem or needs or strengths that will help them achieve their desired goal in a set amount of time. So now that we know what care plans are, how do we get started? So creating a care plan, as you start collecting data for your assessment, start thinking about the problems, needs, and strengths of the resident. Look for or read any care plans from the hospital or other facilities. Use the results of your assessment, for example, the MDS or CA, and then any resident identified concerns from the interview. So creating a care plan as far as goals, find out what the residents' nutritional goals are. Ask them. Ask how you can help them achieve those goals. Offer any guidance and suggestions on how to achieve those goals or goals for issues that you identified in the assessment process. Provide education to the residents so they can make educated choices, and ask them if they have a time frame in mind for reaching their goal. Ask if they're really committed to this plan, or is it something they would like to do but aren't really willing to put the work into it. Let's talk briefly about interventions. Interventions should reflect the problem and help to achieve the goal if the resident is committed to or capable of working toward the goal. If monitoring is an approach, then make sure you document the monitoring and document any action as a result of that monitoring. Make sure we always address F325. It's important that the care plan address insidious, abrupt, or sudden decline in intake or insidious weight loss that does not trigger review of the nutrition status CA. For example, by intensifying the observation of the PO intake of the resident and eating patterns, monitoring for complications related to poor intake, and seeking underlying causes of why they're having the weight loss. So it may not trigger in the 5, 7.5, and 10%, but it's something that we have to be aware of and take action. So insidious means causing harm in a way that is gradual or not easily noticed. Let's talk a little bit about writing the care plan. So in the care plan, the problem or strength reflects the resident's personal concern or facility assessed concern. One problem or strength should not look like an assessment summary statement. Goals should be reasonable, attainable, can be a series of goals to reach a bigger goal. Keep problems and goal related. So example, weight problem, weight goal. And then approaches, they should be reasonable. They should also actually help to achieve the goals or goal. There's different ways to write the care plan. One would be resident plan, so it sounds like the resident wrote it. PES-like is related to problem, etiology, signs, and symptoms from the nutrition care process, or resident stated or identified. Use the term resident or resident's name. Here's some examples of what a resident planned care plan would look like. For example, it might say, I am overweight because I eat complete meals and routinely snack on junk food, and I'm not very active. I want to lose weight so that it's easier for me to walk. I would like to lose 10 pounds in the next 3 months without being undernourished. Examples of ways that they could achieve that: I would like smaller portion meals. If I find I'm hungry between meals, I'll let nursing, dietary manager, or dietitian know so we can make adjustments. I'll attend exercise club. I'll eat the meals provided. I'll eat fruits and vegetables, low-calorie foods when I do snack. These are just an example of resident plan to care plan. Example of a PES-like care plan would be resident is overweight related to energy intake greater than energy expenditure due to eating complete meals and routinely snacking on junk food and is not very active. So that would be the statement that would make it PES-like. Resident to lose 10 pounds in the next 3 months without being undernourished. And you can see some of the interventions there. Serve smaller portion meals, similar to the previous slide. Adjust approaches if needed. If the resident complains of hunger, weigh weekly, provide diet as ordered, offer fruits, vegetables, low-calorie foods when snacks requested. And here's an example of a resident-stated care plan. Mrs. Smith, or Mary, is overweight and wants to lose weight so that walking is easier for her. Mary will lose 10 pounds in the next 3 months without being undernourished. Approaches would be providing smaller portion meals, invite to participate in restorative walking, invite to exercise club, remind to eat the meals provided, provide diet as ordered, adjusting for dislikes or allergies, offer fruits and vegetables and low-calorie foods when snacks requested, weigh weekly. So living the care plan. So F325 guides us in our nutrition care plans. The care plan is updated as needed, as conditions change, as goals are met, as interventions are determined to be ineffective, or as specific treatable causes of nutrition-related problems, for example, anorexia, are identified. If nutritional goals are not achieved, different or additional pertinent approaches are considered and implemented as indicated. And pertinent documentation can help identify the basis, for example, current resident status, prognosis, and resident choices for nutrition-related goals and interventions. And remember, documentation shows you're living the care plan, that the care plan just isn't sitting in a drawer, that you're actually looking at it, you're changing it, you're updating it. The initial care plan documentation should include nutritional care plan based on result of assessment of the resident, result of resident family interview. Write the care plan using nutrition diagnosis as a guide. Follow-up documentation in between and in quarterly. Explain where the resident is as far as their nutrition goal. Address any changes in the plan. And this will also help prevent avoidable rehospitalizations. Let's take a short quiz on care planning made easy. Number 1, examples of care plan approaches are A. Dining in room per resident preferences or dining with friends per resident preference. B. Dining in atmosphere with reduced or limited distractions, for example, no loud music, no disruptive talking, limited movement, no TV or similar. C. Notify appropriate parties of unplanned weight loss or gain. Or D. All of the above. And the answer to question number 1, examples of care plan approaches are, and that would be D, all of the above. Dining in the room per their preference, make sure the atmosphere is appropriate, and then notify appropriate parties of any changes in weight. Question number 2, what is insidious weight loss? A, weight loss that is desired. B, causing harm in a way that is gradual or not easily noticed. C, weight loss that is not documented. Or D, none of the above. And the answer to question number 2, what is insidious weight loss? And that would be B, causing harm in a way that is gradual or not easily noticed. Question number 3, when writing goals for the care plan, they should be A, reasonable, B, attainable, C, both A and B, or D, none of the above. And the answer to question number 3, when writing goals for the care plan, they should be C, both reasonable and attainable. Question number 4 is a true or false question. A resident plan care plan sounds like the resident wrote it. And the answer to question number 4 is true. A resident plan care plan sounds like the resident wrote it. Question number 5, the care plan does not need to be updated when a resident's condition changes. And the answer to question number 5, false. The care plan does need to be updated when a resident's condition changes. Thank you for your participation in today's program. Our goal is for you to use this information in your daily work. We hope you are well served today and every day. If you would like more information about our in-service training programs or consulting dietitian services, please contact us at 1-800-761-4700 9200 or nutritioncaresystems.com.